Let's talk about low testosterone in men. What does it actually mean? And why is it actually not the root problem? This is a very popular topic that I get in the office all the time. You see, most men, they think testosterone is the issue. But in reality, it's often a signal that the metabolic system is breaking down either upstream or downstream. When men come in, they come in tired, they're gaining belly fat, they're losing motivation, they're losing sex drive. And they're always trying to figure out what's actually causing this. So in this video, I'll show you how the testosterone downward spiral works, why the symptoms and labs, they don't always match, and where does testosterone treatment fit in all of this, okay? So we're no longer chasing numbers, but we start fixing the system. Let's jump right in. How does low testosterone actually show up in men? Well, I'm gonna give you some examples of what I hear. I'm exhausted even after sleeping, or Doc, I can't lose weight anymore, especially around my belly, or Doc, my sex drive is down and that's not normal for me. Give me a bunch of Viagra. Just kidding. Or I don't feel as strong or as sharp or as motivated as I used to. You see, these are the most common ways low testosterone shows up, and it's often tied to sleep, chronic stress, metabolic health issues, weight gain, insulin resistance. So to answer your question as to how does low testosterone show up, it shows up as a quality of life problem. The belly fat clue. Guys, this is a big clue here. If your weight gain is mostly in your belly, this is one of the clearest medical clues that testosterone and metabolism are being affected. What do I mean? Why? What does that mean? Belly fat is not the same as fat in your arms or in your legs, guys. Belly fat is actually hormonally and metabolically active, so it behaves differently. It doesn't just store calories, okay? This belly fat, it sends signals that actively interfere with blood sugar control and testosterone, okay? So these signals, they're affecting blood sugar, they're affecting your testosterone in positive or negative ways, usually negative, okay? Those signals from the belly fat travel through two main routes, all right? Route one, let's call it the insulin metabolic pathway. Hear me out, we're gonna nerd out for a second, but as belly fat increases, your body becomes more resistant to insulin. So then the blood sugar stays higher longer in the body, and that insulin resistance leads to higher insulin levels. Higher insulin levels suppress testosterone production. And this is where the cycle starts to feed in on itself in a very vicious way. Watch, hear me out. As belly fat increases, insulin resistance worsens. Insulin levels now stay high. That high insulin pushes testosterone down, as I mentioned earlier. Low testosterone now, it leads to less muscle. Less muscle actually worsens insulin resistance. And guess what? And just like that, insulin resistance just makes the belly fat even easier to gain. So now belly fat increases and the process just repeats itself in this crazy vicious cycle. And that's route one. There's a second route, route two. We'll call it the inflammation and stress pathway. It's not really a new mechanism, it's kind of the second arm of the same problem. Belly fat releases inflammatory chemicals called cytokines. Now, chronic inflammation, it tells the body, hey, dude, I'm under stress. Can you just conserve energy? So the body, it shifts away from muscle building and recovery and hormone optimization. It shifts away from this and goes towards fat storage, fatigue, energy conservation. And in doing this shift, it also suppresses testosterone and also worsens insulin resistance. So practically, this shows up as very specific, very common changes. Your belt starts getting tighter even though your meals haven't really changed, or your belly's growing but your arms and legs, they kind of look the same or maybe even thinner, all right? Or workouts, they feel harder, soreness is lasting longer, your energy crashes are hitting earlier in the day, you're just not recovering very well. So now you know that belly fat is not just a cosmetic thing, all right? It's your metabolism signaling that testosterone is being pushed down, and that cycle is going to keep reinforcing yourself, making testosterone harder to recover over time. Talk with your doctor because you can intervene early. Why your symptoms and testosterone labs often don't match. This is one of the most confusing parts of low testosterone. Some men have low testosterone on labs and they feel completely fine. Other men, they feel exhausted, they're gaining belly fat, they're losing their libido, yet when we check their testosterone levels, they're normal. How can both be true? Very good question. Here's the rule we follow in medicine. Testosterone deficiency is diagnosed really only when you're having low testosterone levels and you're having those compatible symptoms and they're occurring together, because a low number by itself is not a diagnosis. Testosterone levels in healthy men exist on a wide spectrum. The range is like 200 to 800. In different men, they function normally at different points in that range. So there's no single cutoff where symptoms suddenly turn on. So many men with low testosterone, they feel fine, and many men with symptoms end up having normal testosterone. The labs and symptoms overlap, they don't perfectly match. But here's another important piece people miss. Testosterone is highly responsive to stress signals in the body. Common stressors that can suppress testosterone include weight gain, insulin resistance, poor or fragmented sleep, chronic inflammation or illness, ongoing physical or psychological stress. This is the same reason testosterone often drops during acute illness, severe sleep deprivation, obviously, periods of major stress, obviously. In these situations, the body is prioritizing survival and energy conservation. It's not thinking, hey, let's build muscle, let's reproduce, let's hit our peak performance. It's not thinking that way. So when testosterone drops in response to these stressors, it often reflects a reversible suppression. So it's not permanent failure of the testosterone system. That's why, some men with low testosterone have minimal symptoms, and ones who, once they improve their sleep, their weight and stress, people who do have low testosterone can bring it back up by improving those aspects of their life. So this is also why testosterone replacement therapy alone may disappoint. It is just a band-aid, because if testosterone is low because of these ongoing stressors, if you simply replace testosterone without addressing the underlying problem, it's just a temporary band-aid. That's why some men feel only partially better or feel better only briefly and then plateau when they're taking testosterone replacement therapy. So even though you're replacing the hormone, you're still having stress and it's still driving the suppression. So you need to address that. This is how it all comes together, okay? Low testosterone plus no symptoms, no treatment, all right? Symptoms and normal testosterone, look for the other cause, the other stressors, and bring them down. Symptoms plus confirmed low testosterone on repeat morning testing. Now we're talking about like a testosterone deficiency, and it's on the table. And treatment may help, especially when combined with fixing sleep, the weight, the metabolic health. Got to put it all together, people. All right. Testosterone levels vary between men, and symptoms don't start at a single cutoff. That's why we only diagnose and treat low testosterone when the symptoms and labs and the clinical context, that whole thing, all line up. All right. So remember, testosterone is part of the picture, but it only, it works best when you address the system that surrounds it. That's where you'll get the best outcome. How do doctors actually diagnose low testosterone, and why isn't one blood test enough? Diagnosing low testosterone is not about a single number. It's about identifying a pattern, understanding the source, and placing it in the right context. Testosterone is part of a communication loop between three main parts of the body: the brain, which sends the signal, the testicles, which make testosterone, and then you have the rest of the body, which feeds back information through sleep, stress, weight, metabolism. If any part of that loop is under stress, testosterone output can change. Okay, so step one, we have to confirm whether testosterone is truly low or is it just temporarily suppressed, because the levels fluctuate day to day and are strongly affected by sleep, illness, stress, weight, blood sugar, etc. The other part of this is testosterone has a daily rhythm, okay? And it's usually highest and most consistent earlier in the day. So we repeat the test early in the morning, okay? So we need like 2 tests. We need to confirm it on more than one occasion to make sure that it's not just a one-time thing, and make sure that we take that test early in the morning. Step 2, figure out where the signal is breaking down. Doctors look at the control hormones when it comes to testosterone. The hormones from the brain that tell the testicles what to do. And there are 2 main ones, okay? LH, luteinizing hormone. This is the brain's direct signal telling the testicles to make that testosterone. And then there's FSH, follicle stimulating hormone. This supports sperm production and helps confirm how the testicles are responding. Looking at testosterone together with LH and FSH tells us where the problem lives, okay? So if testosterone is low and LH is high, that means the brain is sending a strong signal, but the testicles are not responding. This is what we call primary hypogonadism. Big word, I know. But basically what you need to know on that is the issue is at the testicles, okay? That's the primary source. Now, if testosterone is low and LH is low or normal, the brain is intentionally turning the signal down. This is called secondary hypogonadism. Another big name, very similar. But here, the issue is higher up in the control system. So it's in the brain. So it's higher up in the control system in adult men. So today, the second pattern is stress-related, brain-driven suppression, okay? And this is by far the most common, all right? Now, step 3, interpret the cause. We have to decide whether this suppression is reversible, persistent, or permanent. And this is pretty critical distinction to make, okay? Here's what those actually mean in real life. Reversible suppression means testosterone is low because the body is under temporary stress. And this is common when the main drivers are things like poor sleep or sleep apnea or weight gain or insulin resistance or chronic stress or inflammation or illness. I know I've said that 100 times, but that's how important this is. When those stressors improve, testosterone often improves with them, sometimes significantly without hormone replacement. Persistent suppression means the stress signals have been present for a long time. The body has adapted to a lower testosterone set point. In these cases, lifestyle and metabolic improvements still matter, and testosterone may improve partially, but symptoms or levels may not fully normalize. These are often the men who feel better with testosterone added after the system is addressed. Now, permanent deficiency. Permanent deficiency is less common. This is when the testicles truly cannot produce adequate testosterone despite strong signals from the brain. This can happen after significant testicular injury, or chemotherapy, or radiation, or certain genetic or severe testicular conditions can cause this, all right? So if we don't make this distinction, we risk either labeling a reversible problem as lifelong or delaying treatment when replacement is truly needed. So understanding which category you're in guides the right plan and prevents unnecessary fear or unnecessary treatment. Remember, a testosterone number is information. Diagnosis comes from understanding the pattern, the source, and the context. What actually helps testosterone? For most men, the biggest improvements come from fixing the systems that are suppressing testosterone, not from chasing the hormone alone. Because when sleep improves, insulin resistance improves, inflammation drops, muscle mass starts coming back online, testosterone often rises on its own, and symptoms improve at the same time. That's why the foundation usually looks like this: improving sleep quality and consistency, losing visceral belly fat, strength training to rebuild muscle, treating insulin resistance or prediabetes, reducing the chronic stress where possible. These steps directly interrupt the downward testosterone spiral that I have taught in other parts of this video and other shorts. Testosterone therapy can help some men, especially when levels stay low despite fixing these other systems and these other factors, or when symptoms remain significant, okay? That's when testosterone therapy is actually helpful. But it works best when it's layered on top of good metabolic health and not used as a shortcut to get around it. When men focus only on testosterone, they often miss the changes that would give them the biggest and most durable improvement. So when they focus on the system first, testosterone, whether natural or supplemented, works better. The goal isn't to chase a number. It's to get you feeling stronger, clearer, and more like yourself again. Low testosterone is usually a signal, not the starting problem. For most men, it's pushed down by poor sleep, stress, belly fat, and insulin resistance, not really by failing testicles. That's why symptoms in labs don't always match and why chasing the number alone often misses the fix. Fix the system first, Then decide if testosterone belongs in the plan. Remember, low testosterone isn't a sentence, it's feedback. Dr. Merchant out.